What's going on, UMSocial students? I'm here outside the Rackham Graduate School. I would like to introduce you to Dr. Rob Ernst. So great to meet you.
It's my pleasure, Cam.
So Dr. Ernst is the Associate Vice President of Student Life for Health and Wellness. Also, you're Director for COVID-19 response on campus. So how are we doing with COVID-19 this year?
Well, right now things are doing pretty good. Back 3 or 4 weeks ago when the campus was repopulating, we saw, more cases than we had hoped for, but fortunately things stabilized pretty quickly. And for the last couple of weeks, it's been declining really on a day-to-day basis. So right now we're in a pretty good spot.
So it sounds like it's great news that a lot of the COVID tests that we're having aren't coming back positive, but it seems like the vibes around campus are relatively positive. Would you agree with that?
Yeah, I totally agree with that, particularly compared to a year ago when many of the students were, having to live and learn in a remote way. This high level of vaccination and the way it impacts the pandemic right now has allowed us to resume a lot of the activities that really make this a vibrant university town and a vibrant and valuable college experience.
Yeah, and for me as a student, I can agree with that. And you're a Michigan dad as well, so I'm sure your students can agree with that too.
For sure. I saw firsthand how the students were struggling with the lack of connection with other people, and it's just a night and day difference.
So sort of pivoting now away from COVID-19, what other concerns are there in terms of student well-being as we continue to recover from this disruptive pandemic?
Yeah, I think even before the COVID pandemic, we were really worried about student well-being and student mental health. And the COVID crisis has, if anything, made that a lot worse. One of the things that's come out of COVID, though, is that there are groups on campus that are working together in better ways to solve big problems, like COVID, like student mental health. So some of the things we've launched this fall have included a new early access program for the counseling center, so it should be easier for students to get in to see a CAPS counselor. We've expanded wellness coaching at Wolverine Wellness, which I think is terrific. A lot of students like that option. And we've got more apps and technology available to help address student mental health. It's not a one-size-fits-all, and we're trying to just make more available to students in different ways.
So we've made so much progress, but there's definitely still ways for us to go. There's going to be things that continue to look different than they were pre-pandemic, right?
Well, you're not wrong, Cam. I think that COVID itself is going to be with us for a while. So going forward, I think it's really important for students, if they want to keep their classroom environment healthy and keep this campus healthy, to pay attention to the advice of the healthcare professionals. If they say it's time for a COVID booster, get that booster. But get a flu shot every year. I think that's really important. But the most important thing is if you're not feeling well, isolate yourself from other people right away. Don't go to class, don't go to the party, and call UHS. Get evaluated and get tested.
There you have it, Wolverines. Dr. Ernst, thank you so much for taking the time today. Before I let you go, gotta get a Go Blue.
Go Blue.